Welcome to another episode of Med Madness, your go-to podcast for comprehensive medical education. Today we'll be delving into the critical topic of infection control, focusing specifically on isolation precautions. These precautions are essential in preventing healthcare-associated infections and ensuring patient and healthcare worker safety. We will discuss the different types of isolation precautions, airborne, contact, and droplet, and the specific pathogens associated with each type. By the end of this episode, you will have a clear understanding of how to implement these precautions effectively in a clinical setting. Now, let's talk about droplet precautions. Droplet precautions are used for pathogens spread through larger respiratory droplets that do not stay airborne for long distances. Key pathogens include bacterial infections such as Neisseria meningitis, Haemophilus influenzae type B, and Mycoplasma pneumoniae, as well as viral infections like influenza virus and adenovirus. The key requirement for droplet precautions is that masks should be worn within 1 to 2 meters or 3 to 6 feet of the patient to prevent inhalation of infectious droplets. Moving on to standard precautions. Standard precautions are the basic level of infection control that should be used for all patients, regardless of their infection status. This includes hand hygiene and the use of gowns, gloves, and masks when necessary, particularly during procedures that involve contact with bodily fluids. Now, let's consider a real-life scenario to highlight the importance of these precautions. A 65-year-old patient with a history of waning immunity was admitted to the hospital with widespread crusted and non-crusted lesions across the body. The patient was diagnosed with primary VZV, chickenpox, which is highly transmissible through airborne and contact routes. The healthcare team immediately implemented airborne precautions by placing the patient in a negative pressure isolation room and ensuring all staff wore N95 respirators. Contact precautions were also enforced, requiring all staff to wear gloves and gowns while in the patient's room. By adhering to these precautions, the healthcare team successfully prevented the spread of the infection within the hospital, protecting both patients and staff. To summarize, isolation precautions are a cornerstone of infection control in healthcare settings. By understanding and correctly implementing airborne, contact, and droplet precautions, we can significantly reduce the risk of healthcare-associated infections. Remember, the key components for each type of precaution include appropriate use of protective equipment and strategic placement of isolation rooms and supplies. We encourage you to engage with our pre- and post-podcast quizzes and Anki flashcards to reinforce your understanding of this critical topic. These tools are designed to enhance your learning experience and ensure you retain the essential information covered in this episode. Thank you for listening to Med Madness. Stay safe and continue to prioritize infection control in your practice.